giving us the moral boost to continue with this humble mission of ours, which we had started 20 years back on this very day. Believing that Dada is still somewhere near us, at this sacrosanct moment, I wish my brother a very happy birthday. The trust was instituted on a pure personal note to pursue Dada's mission, which was to deliver the values of harmony, spread the message of common brotherhood and humanism, and most important of all, to pursue Dada's mission of achieving excellence in every sphere of life. The institution of the library in the year 2003, immediately after Dada departed from our midst, since known as the Dr. Amitabh Chowdhury Memorial Library at the Guwahati Medical College Hospital in the year 2003, and thereafter the initiation of the Dr. Amitabh Chowdhury Annual Memorial Lecture Series in the year 2004 was but a small part of our effort. If we have been able to walk this far and organize the lecture even during the turbulent times that we had all gone through during the time of the pandemic, albeit virtually, esteemed distinguished members, it is because of the tremendous moral support, encouragement, and assistance that we have received from all of you all at every phase of our life. With a deep sense of gratitude and utmost reverence to all, I bow down before you all. With the permission of the August gathering, we would now like to start this evening's proceeding by requesting our President, Justice Hirendranath Sharma, to come up to the dais and take up his seat here. One of our trustees or volunteers may kindly escort Justice Sharma to the dais. The presence of our guest speaker, Professor Dr. B.R. Jagannath, reputed cardiothoracic and vascular surgeon, presently based at Whitefield Hospital, Bangalore, along with his better half, Madam Jagannath, herself a teacher, has added dignity and grace to the annual lecture. We, the members of the family, convey our deepest reverence to the Dr. Jagannath, he being that teacher and mentor with whom Dada had the opportunity of having his first practical lessons in cardiac surgery at the Southern Railway Headquarter Hospital, Perambu. At the railway hospital itself, Dr. Jagannath has performed more than 3,000 open heart surgeries, which includes valve replacement, Ross procedure, a procedure used to treat diseased aortic valve, amongst others. At the Southern Railway Hospital, it was Dr. Jagannath who had introduced the radial artery grafting and the concept of total arterial revascularization. Ladies and gentlemen, kindly join me in welcoming Dr. Jagannath with a round of applause. May I now request the dignitaries present at the dais to light the ceremonial lamp. May I also request Chandan Singh Bankoti, Vikram Singh Deo, Wangchuk Kelon, Dr. Don Paul, if he is here, to join the dignitaries in lighting the lamp. Rakesh Agarwal, who has also joined Dada's friends from Assam Rifles Public School. The felicitation ceremony shall now begin. May I request our volunteers to come to the dais and felicitate our President, Justice. Apart from being a trustee, Justice Kirendranath Sharma is an integral member of our family. May I now request our volunteers to felicitate our guest speaker with a gamusa and a bouquet of flowers, and tears to felicitate our guest speaker with a gamusa and a bouquet of flowers and a plaque that has been memento that is presented on behalf of the trust. Ever since 2022, in honor of some of the leading personalities of the soil, who has at the same time been of an invaluable help to the members of the family, as well as helped us in giving a shape to the activities of the trust. We had been honoring some such personalities. Last year, we had presented an honor to Sri Jotin Hazarika, under whose guidance we, the trustees, have moved this far, and to Dilip Hazarika, revered Dilip Da, to our parents and elders, who unfortunately is no longer amidst us. The members of the family are indebted to Sri Povindra Datta Chowdhury, better known to all of us as Opu Datta Chowdhury, for the constant support he has provided us all. Both the leading personalities, namely Sri Jotin Hazarika and Opu Datta Chowdhury, could not make it to today's lecture, physically. As a mark of gratitude, the members of the family and the trustees on the resolution being passed by the two settlers have taken the opportunity to present a small mementos to Sri Opu Datta Chowdhury. I believe he couldn't make it physically to this lecture. May I request Bhaskar Datta Borua to come up to the dais and receive the honor on his behalf. The invaluable contribution of Sri Prashanta Kumar Goswami can hardly be put in words. I know sir does not like it, so I beg to be pardoned. As has been resolved by our settlers, we would wish to present you with a small memento. May I request Dr. Shehnaz Rahman to present the memento to Sri Prashanta Kumar Goswami. The Trust Board has been able to function because of the active assistance of Justice Hirendranath Sharma, Sri Nitin Chandra Borua, Mr. Kamrul Hussain Chowdhury, to name a few. In grateful appreciation of the constant support they have given us, and as resolved to by the two settlers, we would wish to present them with a memento each. May I request one of our volunteers to come up to the dais and present a memento to Justice Hirendranath Sharma. May I further request Dr. Shehnaz Rahman or one of our volunteers to also felicitate Sri Nitin Chandra Borua. Another great personality who has been of constant support to the family as well as to the trust, and basically guiding us even while being absent physically, that's Mr. Justice Amitabh Roy. May I request one of our volunteers to present the memento to Justice Amitabh Roy. And since sir is absent today, may I request Abhishek Roy, his son, to come and accept the same. an elder brother for the family, and a good friend of my dear elder brother Amitabh as well as us was our dear Salim Dada, Kamrul Hussain Chowdhury. May I request one of our volunteers to felicitate Kamrul Hussain Chowdhury with a memento. It was a bleak day for us when on that fateful day, Dada suddenly departed from our midst. Since that time, Dr. Manmohan and Dr. Pankaj Srivastava, both cardiothoracic and vascular surgeon, has been a constant companion to the family. In a way, they have both had a role somewhere to help us find out ways to keep Dada's memory alive, just as it has been Chandan Singh Bankoti and Vikram Singh Deo, the duo from Assam Rifles Public School, who is happier to be introduced as an old Lightcorian, as they have not both missed every single opportunity to be with us, more particularly at every memorial lecture. We offer our grateful appreciation to both Chandan Singh Bankoti and Vikram Singh Deo. Now the rendition shall now begin. The Sangeet Natak Academy Award winner, Sri Gunin Oja is with us. May I request him and his team to start the rendition. He'll be accompanied with Dhananjoy Oja, Rupak Bayon, Narayan Oja, Mrinal Jyoti Das on the tal by Dilip Das, Noren Pathak on the Nagara. তুমি কৰি দিয়া মই নাজানো আৰু কি বা গাব কি বা গাব ইফালে আগত দিয়া সাইড কৰি দেখা নাপাব ক'ব নহয় মই কৈ দিছোঁ Sri Gunin Oja is a teacher by profession and
a renowned person in this art. In Borpeta, nothing takes place, whether holy or otherwise, without Gunin Oja. He will now render Gunin. I request Oja to speak out. Apuni koi diok. Olop ki kini. Mohar kotha khano koi dia. Mohar kotha khano.
শ্ৰদ্ধাভাজন মঞ্চত উপস্থিত মোৰ শ্ৰদ্ধাৰ বিশিষ্ট ব্যক্তিসকল আৰু মোৰ সন্মুখত উপস্থিত শ্ৰদ্ধাৰ সুদীয়জনসকল, আমি এতিয়া বৰপেটাৰ আৰ্হিত এই মহাপুৰুষ আদৰ্শৰে ৰঞ্জিত গুৰু বন্দনা গাব ওলাইছোঁ। এই গীতটিত নাগৰা সংযোগ কৰিছে মোৰ নৰেন পাঠক আৰু তালত সংগ্ৰহ কৰিছে মোৰ নাৰায়ণ ওজা, আৰু লগত আমি ইয়াতে মিলি গাব লৈছোঁ। গীত ভুল মাতি হ'লে আৰু মাপ ক্ষমা কৰিব। ৰাম হৰি
Hare
আমার পরম গুরু হে হরি আহা হে হরি আমার পরম গুরু। ধন্যবাদ।
There is a small memento and for Sri Gunin Oja. May I request one of our volunteers to present the same. A bouquet of flowers for Sri Gunin Oja. We are grateful to Sri Gunin Oja and his team for creating the ambience for today's lecture. The welcome address shall now be delivered.
Namaskar. Our trustees, Prashanta Kumar Goswami, Justice Hirendranath Sharma, Justice Surana, Rup, Judge, my dear Dr. B.R. Jagannath, our esteemed guest speaker, Honorable Judges of the Guwahati High Court, former and present our colleague, legal fraternity, Ashut Kumar Boshya, Biju Dutta, Principal, my friend Naren Dutta, Shaigya, all instead of not naming, all my friends, teachers, and dear friends of Amitabh, Chandan Singh Bankawati, Bikram Singh Deo, Wangshok Kalung, all three of them who has taken the initiative to attend the lecture. Amitabh's friends and family friends who are amidst us today. These boys are since beginning are participating in this function. And who amidst of us, all of those who have travelled all the way to Guwahati, especially attending to respect and respected ladies and gentlemen, a warm welcome to you. Today, 19th December is a special day for us. It happened to be the birthday of Amitabh, the pillar of our strength, and maybe with many of you seated here today. Amitabh did a special relationship as well as he had in him a strong will to be service of the people. The ever-giving nature of our dear son made us to institute this Amitabh Memorial Trust with the support of the friends and the family and the members of the society. The mission of the trust was to receive the valuable bit which Amitabh would have done had he been with us. The trust is making every endeavor to contribute its own way, that little something to human well-being. With a deep sense of gratitude, we, the members of the family and the trustees, recall the tremendous encouragement and support of you. The trust was initiated for a cause which at the same time was very personal to us, but the support of us allowed us to come this far. Despite having witnessed the turbulent times for more than 2 years, in 2023, when we got to see your cheerful faces, Jagannath is also here today. On behalf of the family members of the family and Board of Trustees, we welcome you both to Guwahati and heartily welcome Dr. Jagannath to this evening. We are also grateful We pay our thanks to Master Roy, son of Justice Amitabh Roy, who used to always participate with us, always with us. And even he's not keeping well. His wife is also not keeping. Despite that, he is keeping contact. Saint Abhishek, a lawyer in Delhi, practicing in Delhi. I must add my gratitude to our trustees, Sri Jotin Hazarika, and to all esteemed guests for having taken out time to attend. We have to invite our guest speaker, Dr. Jagannath, to deliver the lecture on the cardiac surgeon in India. Dr. Jagannath.
First slide. Yeah, the first slide. Yeah. It comes to this side. Huh? Shri Guru Bhyo Namaha. Guru Brahma, Guru Vishnu, Guru Devo Maheshwaraha. Guru Sakshat Parabrahma. Tasmai Shri Guruve Namaha. With these words, I'm reminded of my dear friends, Dr. Amitabh Chowdhury. This is a poem written by Thomas Elegy, elegy written in a country churchyard by Thomas Gray. Full many a gem of purest ray serene, the dark unfathomed caves of the ocean bare. Full many a flower is born to blush unseen and waste its sweetness on the desert air. But today, Justice Chowdhury, Trustee Dr. Sharma, and all of you people have made sure that this flower will not waste its sweetness on the desert air, nor will its rays stop shining. This is Dr. Amitabh Chowdhury. And I was thinking how I could generate interest to come into this particular field and not any other field. So let me give you a little bit of history regarding cardiac surgery, the field chosen by Dr. Amitabh. Now, this gentleman is from Germany. I looked very hard to find if there were any parallels in our history. Neither in Egyptian history nor in our Hindu history is there any direct reference to heart surgery. Yes, Sushrita and Charaka were very much related to the practice of medicine, but this was the man in 1897. September was the day. It was a dark night. There was a brawl in the bar in Germany, and a patient was stabbed in the chest. He was brought with a wound to the hospital, and this gentleman, who was called Ludwig Renn, took the patient to the operating room the next day, opened up the chest and opened up the covering of the heart, and after that found a small hole in the heart bleeding. This bleeding hole he stitched up, brought the patient back. The patient fortunately lived to tell the tale. This is back in 1897 when not much was known. Not only that, this was presented in 1898 to an audience of surgeons. Dr. Ludwig Wren thought that he would receive a lot of accolades, but unfortunately, he was not applauded. People criticized him. Basically, Theodor Billroth was a leading general surgeon at that time, and he criticized him for having touched the heart. The brain was not visualized. The heart was supposed to be the seat of emotions, and this heart was sacrosanct. This gentleman put a stitch in it. Though he saved the life of the individual, he was criticized. Nevertheless, by the turn of the century, that is by 19,000, he had collected 127 such cases and presented them, and only then cardiac surgery began to look up. Still, you could not take the heart and stop it. All you could do was operate outside the heart. This gentleman, Robert Gross, he tied off an abnormal vessel which was connecting and producing excessive blood flow to the lungs. The patient who was having a lot of chest infections, recurrent, was not gaining weight, began to put on weight, recovered from all the infections, and did very well. In the meantime, the lady in the center, Helen B. Taussig is her name, she was looking at ways in which you could bring down the blueness of a baby who was born blue. She's holding a cyanotic child. Now, when she heard that Gross had tied off the excessive blood flow to the lungs, she said, no, this lack of blood supply to the lungs is what is producing the blueness in this baby, and therefore, can we not put a pipe which connects both these two? This was brought to light by the gentleman on the top right, Alfred Blaylock, and the gentleman in the middle, who is Vivian Thomas. Incidentally, Vivian Thomas was the main mover. He did all the practical investigation and work in this field, and he stood behind Alfred Blaylock as he performed the surgery, and the baby went home successfully cured of the blueness of the nails. Now, one of the most important things in heart surgery is, if you stop the circulation or if you stop the heart, the brain dies within 3 minutes. Maximum it will last about 5 minutes. The remaining organs will start getting damaged. Not only that, many of you would have seen a car engine. If in the olden days, if a little bit of air gets into the car engine, the engine seizes and does not start again for a long time. Similarly, in heart surgery, once you open the chamber of the heart and air goes inside, the circulation stops. Not only that, it does not supply brain and other organs with adequate amount of oxygen. This gentleman came up with a brilliant solution, Dr. C. Walton Lillihei. What he did was, he took a donor, usually the father or the mother of the child, connected up both the circulations using a series of pipes. Now, the parent supported the brain and the organs of the body of the child, allowing the doctor to take the heart out of the circulation, repair the heart, and put it back inside. It was a brilliant concept, executed very well. He did 40 odd cases. But imagine, if anything went wrong, 2 lives were at stake, not 1 life. This gentleman managed to do 40 cases without loss of even a single life. Subsequently, we cannot keep on having a situation where you could lose 2 people at the same time. So we were looking at ways in which we can support the circulation as well as the breathing and gas exchange. And this gentleman, John Gibbon, he invented what we call as the heart-lung machine. This heart-lung machine supports the circulation during the time when the heart is stopped, allowing us to go inside the heart and repair whatever are the defects. Needless to say, once this machine was perfected and brought to the forefront, cardiac surgery took off like the rocket. And these 2 gentlemen, Denton Cooley and Michael DeBakey, were responsible for majority of the improvements in cardiac surgery. In fact, they started what was a factory for heart disease treatment. They were operating almost 30 to 40 operations per day. That is what is done generally in these days in a period of a month in most of the major centers today. In the center you see their prime invention, which is an artificial heart. While this was going on in the rest of the world, India was not silent. Messina Hospital was established way back early 1900s, and Bomi Bilimura, like Dr. Robert Gross, did the first PDA ligation in 1949, which is just about 10 years after it was done in the world. This gentleman, Dr. Prafulla Kumar Sen, he was the first person to do coarctation repair. That is, the blood supply to the lower half of the body gets pinched off by a small segment which is very narrow. Not only that, he was the first to attempt heart transplant surgery in India. Unfortunately, it was not successful, but he was the 4th surgeon in the world to attempt this particular deed. Our own heart-lung machine indigenously was prepared by Dr. K.N. Dastur in Nair Hospital, Mumbai, and it followed very closely what was achieved by John Gibbon. Now we come to where, starting from what you call as bursts of inventions, now the whole thing has to take off. And these 2 gentlemen, the one who is in the middle with the circle, that is Dr. T.J. Cherian, and one who is in the top, Dr. N. Gopinath. These 2 were classmates and colleagues and friends, and they decided that we should take cardiac surgery forward. Dr. T.J. Cherian joined the Railway Hospital, Perambur, whereas Dr. Gopinath went on to complete his career, post-graduation in cardiac surgery from Vellore and establish the All India Institute in Delhi. So now we have, at the beginning of this era, 3 major centers in the country. The first and foremost was Christian Medical College, Vellore, and then we had the Perambur Railway Hospital, the same hospital where Amitabh came down to further his career, and then the other one was All India Institute, Delhi. The one on your right is Perambur Railway Hospital, the one on the left up is All India Institute, and the one in the bottom is this one. An interesting story is present over here. In USA, Minnesota and Texas, Minnesota and the Boston Children's Hospital, where cardiac surgery really took off, were separated by about 140 kilometers. You cut back to India, CMC Vellore and Perambur Railway Hospital shares the same distance. This is Professor Betts on the right, on your right side. He was the one who started Department of Cardiac Surgery in Vellore Hospital, and the one on the left is the same gentleman who is flanked by Dr. Stanley John. All of you must be knowing extremely well about Professor Stanley John, who was responsible for development of child heart surgery, and it was pioneered at CMC Vellore. Meanwhile, Dr. T.J. Cherian came down to Perambur Railway Hospital, established the first cardiac surgical unit, and his main contribution was he brought these 2 stalwarts to cardiac surgery at Railway Hospital, Perambur. One was Professor Girnath, and the other one was, all of you know, Dr. T.J. Cherian. Dr. T.J. Cherian was my mentor, and Dr. Girnath, I unfortunately could not, is the Frontier Medical Lifeline. His main thing was he was doing child heart surgery. Incidentally, he was the person who first started bypass surgery and did the first bypass surgery in India. But in spite of him doing the first bypass surgery, it was Dr. Girnath who established the Apollo chain of hospitals along with Dr. Pratap C. Reddy, and they are now considered as a factory for coronary artery bypass surgery in India today. This is another great stalwart who joined the Perambur Railway Hospital, Dr. K.R. Balakrishnan, Dr. Ganesh Mani. Dr. K.R. Balakrishnan is pretty well known to you basically because of his great work in transplant surgery. He today has the largest number of heart transplant in the country and is ranked probably within the first 5 in the world for the numbers of heart transplants that he has done. This is his greatest achievement, but he is also known for his congenital heart surgery. Dr. Balakrishnan went on to establish 3 hospitals. One is SRMC in Chennai, the other one is Fortis Malar again in Chennai, and the third one is MGM, which is again in Chennai, and he is still practicing. He was also one of my mentors. I joined the Railway Hospital in 1984, so almost 35 years back, as a senior house surgeon. I was selected by the UPSC and posted to Southern Railway, did my post-graduation in general surgery, did my postdoctoral in cardiac surgery, all at Railway Hospital, Perambur itself. And Dr. Afroz Farooqi was leading the unit when Amitabh Dada came in. Unfortunately, the rest, I think, should probably be forgotten. But in his memory, what I would like to show you is, you have seen so far what it takes to become a great cardiac surgeon. One of the most important things is selecting the right mentor, selecting the right place to further your career. And Amitabh had done a great job in coming to the right center. So I thought there would be something else which would be of interest to all of you, as well as to the general public in particular. Why are the medical bills so high? Today you go to any hospital and come away, the commonest thing is, oh, I had to pay so many lakhs of rupees just for one surgery, or just for one kind of stent, or any particular thing. It set me thinking, why should it be so costly? So let's see if we can make sense of why the medical bills are high. Let me remind you that I am not against any of these things which I am presenting, nor is it a rant or a tirade against development. It is basically presentation of facts as it came about. Initially, most of you would probably remember that there was one doctor, and that doctor would not only attend to you in disease, he would also attend to your mental well-being, he would also attend to your social problems, he would also be a place where you could go and say, Dada, I am not feeling well, these are my issues, can you do something? Slowly what happened was, this became from single doctor to multiple doctors, basically because there were many more people who came in for treatment. The multiple doctors also could not, cover every single thing. So therefore, what happened was, these multiple doctors gave way to hospitals where one doctor attended the nose, one doctor attended the throat, one doctor attended the chest, one doctor attended other parts of the body. Yes? It meant basically that most of the people received expert care. Sorry for that interruption. Right. So, when this happened, what you found was that these doctors confined themselves to their particular fields alone, which meant that if the cold from the nose shifted to your throat, you had to shift your doctor. And not only that, what had happened was, a lot of investigations came in, and these investigations meant that more number of people would need to be employed by these hospitals. And to manage these more number of people plus more number of doctors, what happened was MBA graduates and the management people stepped in. This is what I meant when I said corporatization of medical care. When this corporatization took place, what happened was, instead of being compassionate medical care, what came out was technology-driven, impersonal health care. And that, of course, it did result from what you saw at the top, poor healthcare facilities, to a streamlined thing down below to a sanitized thing which is present on the left-hand side. But it did not solve all the problems. Into this walked Big Brother pharma industry. What happened basically was the single doctor initially used to prescribe, get his own mixtures. You would get red color mixture, you would get blue color mixture, you would get a pink color mixture, and then he would give you, if you had a sore throat, a blue color mixture. Subsequently, because the numbers increased, he got in a compounder. The compounder was one who could decipher the writing of the doctor. And you all know how a doctor's writing is. But then the compounder again became compounded. Basically because what happened was the number of medicines grew exponentially. In addition to medicines, you also had injections, you also had implants. By implants, what I mean is that you started putting things into the body. If you see externally, people put a hearing aid. If you look at it internally, you will see that pacemakers are now being implanted. I showed you the picture of the heart, artificial heart, that also started going in. All this required industrialization, all this required mass production, and that is where Big Brother pharma industry stepped in. And when that stepped in, compounded with the corporatization, which needed to cater to so many people's salaries as well as benefits, you now know where the medical bills are heading. Now, an individual person could no longer afford medical care without sort of saving for it or without getting somebody else to pay. So what happened is medical insurance stepped in. So now you have three parties which are present over there, one being the poor medical practitioner, the second being the corporate entity, the third being medical insurance and the pharmacy. It would have been fine if each one played their role and let the doctor do his work of curing the patient, so-called curing the patient. We'll come to that a little bit later. But what happened was, along with MBA graduates, share market walked in, and what you found was now that health was reduced to a commodity status. Not only was it reduced to a commodity status, health was now being promoted as a revenue model. People started looking at profits, basically because there were investors who came in, there were shareholders who came in, there was the pharmacy industry, there was the insurance industry, and there was the corporate industry, all of which wanted to take their share from the profits. So once it became a revenue earner, again, compassionate care went out of the window. It was replaced by positive balance sheet or balance sheet in the green. When this came in, there was a lot of allegations of mismanagement of funds, mismanagement of the patient, getting more so that the revenue will come in from these either investigations or any of these kind of things. Litigation started to come to the fore. Once litigations came in, what happened was everything drove the cost northwards. Add to that, the pharmacy industry said, okay, we have got we have brought in this drug. This drug has been trialed over so many patients. In addition to that, we have subsidized this development to such an extent. Now we need to get back our returns from it. Patent rights, intellectual property rights. You have to pay royalty to the people who discovered what was already existing or who made new interventions in technology. Again, pushing the cost northwards. Soon what happened was that the pharmacy, as well as the corporate, as well as the medical insurance, knew that the person who is center is the doctor, and if his incentivization is not done, you are not going to have footfalls in your hospital, and the bottom line is not going to become positive. Therefore, they started incentivizing the healthcare provider. Again, I repeat, healthcare provider. Initially, it was started with doctors, but currently it's now moving down to anybody who can attract patients into this one. It's bad. Did everyone benefit from it? I don't think so. Basically, the top cream benefited significantly from it. And when the top cream, when I say, it is not just the top cream of the doctors, it is the top cream of the pharma industry, it is the top cream of the medical insurance industry, it is the top cream of the corporate world, which benefited from this incentivization. And then this gentleman called artificial intelligence, although there is nothing artificial about it, it is intelligence which came into healthcare delivery. It's poised at a very, very critical moment. What this does is basically, it picks up from the net. As you feed in your symptoms, it trawls through the available literature in the net, and then after that, picks out what probable investigations you need to do. It is also programmed in such a way that it can pick out which hospitals cater to this particular investigation, direct you to there, utilize the results, again go through the literature and bring out treatment options and then put it in over there. Will it replace the doctor? Very, very unlikely, because medicine is not a pure science per se. There is a part which is called as art, and then it is based on science. So the science part is where the experience of the doctor comes from, and this science part can be replaced by artificial intelligence. But the art form that is communicating with the patient, in addition to that, getting the patient to believe in the treatment, is where we cannot be replaced. All of you know, I don't think we need to touch anything more on it. But what I would like to say about the government's policy is that the government is not making a distinction between what is curative treatment and what is preventive treatment, or what is health and what is treatment. Health is something basic which is needed for all people. But treatment is not necessary for all the people. Treatment needs to be individualized to the people, and the government touches everything, makes it all gold, which cannot be consumed or which cannot replace food. That is why I said It's the Midas touch of the government. We'll come to it a little bit more. Now let's just look at the doctor. Does he have some genuine requirements? Does he have some genuine problems? You already heard how he was trying to be coerced, or how he was trying to be incentivized, how his practice was being taken over by artificial intelligence and so on and so forth. But if you just examine from Amitabh's viewpoint itself, his parents and his own okay, right, will do. Yes, exactly. That is the point to which I was just coming to. Now, when Amitabh walked into the railway hospital, he had already completed his basic MBBS training, which definitely needed a lot of financial input, a lot of emotional input, a lot of support from the family. In addition to that, he had completed his general surgical training, where he had done a lot of surgery. And now he had completed his MCH in cardiothoracic surgery, and what he needed was to be given a lot more training in particular forms of heart surgery. And that is why Amitabh came to the railway hospital. He spent a very, very brief period, but he was extremely impressive in the sense that we were basically 2 operation theaters. In addition to that, we had 2 major operating surgeons, me and Dr. Farooqi, and we had about 3 or 4 people who were junior to us, including Amitabh. Amitabh was progressing extremely well. He had done sternotomies. He had done what you call open the chest and expose the heart. Remember, Ludwig Renn was actually criticized for this particular point itself. He had done this. In addition to that, he had performed simple hole closures in his brief period, which probably was about 6 months to 8 months before he lost his life. His approach was extremely pragmatic. His approach was enthusiastic. He would spend a lot of time in the ICU, a lot of time sitting with the patients. His main vision was to gather enough knowledge, gather enough experience so that he could come back to the state, open up a big major center, and cater to the population of this. I'm told that there are a few handful of centers in Assam, in state of Assam, which are doing consistently open heart surgery. And his vision, probably at that time, was there was no center in Assam which was doing open heart surgery, and he wanted to set up probably the first unit. Unfortunately, God did not permit it to happen for his own reasons. The reason I brought it up is Amitabh had invested a lot of time, effort. His family had invested a lot of time and effort. A doctor these days not only has to invest in bringing up resources into the training, he also has to employ resources to keep abreast of the knowledge. That means workshops, that means conferences, that means, attending to other places to learn new things. And again, Amitabh, in that small brief period, went to one or two places to have a look at surgery, how surgery is being done over there. So all this means that you need to support yourself. I will not go into the details of this particular thing. So what we really need to understand today is that healthcare is not about being in positive balance at the end of the day. Basically, it's about compassionate care. What we need to do is, we need to develop more institutions which are being built by entrepreneurs, which are being built by philanthropists, which are being supported by philanthropists, and I'm very, very happy to hear that Justice Chowdhury and the trust over here is doing yeoman service in this particular regard today, and I raise my hat to you. There is public-private partnership which needs to come about. There is build, operate, and transfer systems which needs to be. So again, now, it brings me to the third most important thing. Every day, some of you would go to the surgery and you will be presented with about 10, 15 papers, and most of us generally put signature below it. If it says witness, 2 other people will put witness. If it says spouse, the spouse will put the signature. How many of us actually take the pain to understand what is written over there? Not many. Most of us are in shell shock when we hear that you require an operation. Most of us do not comprehend at that particular point of time what is happening. And yes, very often what happens is people are being pushed to take decisions very quickly. Net result is you do not read anything, you put your signature. If something does go wrong, always it will be shown, look, it is present over here, you have put your signature over here. How come you're questioning now? To prevent that, I think we need to look at a few things. Whenever you invest in a share market, or whenever you invest in anything, you are always weighing the risk versus the benefit. In medical practice, the risk is basically what is called as morbidity and mortality. Mortality, as you all know, is death which occurs during or after a particular intervention. Morbidity is what can occur or what can go wrong in many of these things. The morbidity and mortality is affected by a large number of factors. Yes, the doctor and his team being the central pivot around which, but there are factors which are present in the patient, there are factors which are present in the environment, there are factors which are present in the machine. Even the drugs that you use can contribute to both morbidity and mortality. To cut a long story short, please understand that morbidity can affect any of the organs. In the beginning of the lecture, I told you that the brain dies within 3 to 5 minutes. Rest of the organs start to die within a few hours. Similarly, these are the structures which can get affected or morbidity is present. You can have bleeding, you can have infection, you can have kidney problems, you can have brain problems, you can have lung issues. And it depends on what procedure is being done. In addition to that, how long the procedure is going to be done, under what circumstances these procedures are being done. The exact amount or figure can or should be taken up only when you have a free and frank discussion with your doctor. In addition to that, most of us who are older have diabetes, blood pressure, cholesterol. Many of us are smokers, and some of us have some amount of kidney disease, maybe age-related, maybe disease-related. Some of us have strong family history. All of these will contribute to small amounts of risk when you go in for any procedure, be it a stent, be it operation, be it even medical treatment. There will be some amount of risk involved. So, now that you have heard what is the probable risks involved, let's look at what are the kinds of benefits that you can. I am dealing with generic benefits. I am not dealing with specific benefits as of now because it will become too extended talks. Basically, what you will see is that there could be cure. Does the cure last lifelong? Difficult to say, but in current generation, cure means relief from the symptoms with which you went to the doctor. That cure may be temporary, may be permanent. Very, very few diseases today have permanent cure. All we are doing is giving temporary solution. The other thing is prolongation of life or survival benefit. You go to a doctor and have an operation for a bypass surgery. Now, not in all cases do we know how much the individual was supposed to live, and with this surgery or with this intervention, did he increase the number of years? But what we can know is that on an average, from the life insurance charts, you can say that today the average survival is around 70 years, 74 years. And if we can get this gentleman to go beyond 74 years, it means that he has survival benefit for this particular disease. Most often you will see that a person who goes to the chest pain, after the initial intervention, be it stent, be it surgery, be it anything, there will be a period of time when he becomes symptom-free. That means his chest pain completely recedes. Subsequent to that, depending on the efficacy of the treatment modality, it starts to return. It may return in 10 years, it may return in 15 years, it may return in 20 years. It may not return basically because of some other issue which takes away the life. This is called as disease-free survival. And the other thing is, we all know that birth is constant. Anything which is born has to die. What makes the difference is between birth and death, what is the quality of life that the person enjoyed. And this is where most of the medical management, surgical management is aimed at. A person who goes to the doctor who cannot even walk a few steps, he may not live to 90, but next 10 years, if he is able to do his own activities, if he is able to participate in all the social functions, if he is able to take a lot of other useful, productive activities, then it is an improvement in quality of life. And that is, gentlemen, what we are looking at today. For procedure-specific, I have just given you what is generic. For procedure-specific benefits, And tailoring these broad benefits in terms of percentages is best done by talking to your surgeon. And I encourage you all people to please talk to them, talk to the managing team before you consent for surgery. Ask questions. If you do not ask questions, nobody takes the time off today to explain. All they do is, because everybody is stressed out, everybody is lacking time, you should not hesitate to ask questions. Again, too much information can be overwhelming. I said that when you are presented with a lot of information like I did today, it's obvious that everything cannot percolate in at the same time. It's always wise to take a little time, maybe ask for a second opinion. Again, the caveat is that if you take too many opinions, you will only end up being confused. You cannot make a decision. What I would like to remind you all is that it is the implicit faith, trust in the doctor's ability and his skills that cures you. It is not the amount of money you pay, it is not the questions you asked, or it is not any of those other things which will cure you. And of course, again, I still tell you, we can give you quality of life. We can probably give you a little bit of survival advantage, but it's only faith and God who can cure you permanently of any of these diseases. Amitabh came to Chennai with dream of training and trying to establish a good hospital providing very good care in the state of Assam. Unfortunately, due to mishap, he was taken away prematurely. I have showed you what it takes to achieve dreams. I have also been told that the cardiac care today in Assam state is still in infancy or nascent stage. There are very few centers. Most of them are doing adult work. Still today, our maximum amount of patients coming in to Chennai as well as to Whitefield for open heart surgery comes from the northeastern states. Almost all of the children's surgery come down to Whitefield is from northeastern states. What I think I'm looking forward to is being of some service to help achieve Amitabh's dreams. With these few words, I thank you all for a patient hearing, and I offer my humble pranams to Amitabh. He will always be with us. Thank you.
Doctor is ready to take few questions. If there are any, kindly pose them.
Any questions to him? Otherwise, we'll yes. Varali, Professor Varali. I'll take you a mobile.
cardiac surgeons started in this world as well as in this country. But before that, I shall pray for the eternal peace of Amitabh Chowdhury, in whose honor this memorial lecture was organized. But Dr. Jagannath's view that you have ended by saying that it is all but God who can cure you. I do not understand how you can, being a doctor, put up your hands like that, that it is not the doctors, it is not the surgeons, but it is God only who can cure you. Of course, I myself have full faith in God, but then talking about surgery in the world as well as in this country, and the way you have described the entire dimension of medical science, what impressed me is that we have talked not only about surgery, but we have talked about also investment, about the corporatization of this, and about paying large amount in the bills of the for medical profession. Now, I think you have not given any cure for that. How you can avoid that paying large amount of bill? How you can, of course it is right that being a doctor, you are well versed in investment also, that I have seen from this. So these are just my observation. This is not any question. But thank you very much for a very detailed discussion. And I personally feel that today I am quite enlightened the way cardiac surgery has been developed in this country. Thank you very much.
Thank you. I think that was excellent. If I may paraphrase it, point number one was that God cures, doctor aids the cure. This is all that is one. The second point is there is no solution provided for the increasing medical bills. And the third point was, okay, let me begin by answering the first point. Yes, it is a supreme force. I will not say that it is God or it is something else. What I say is that if you believe in Advaita philosophy of Shankaracharya, what ultimately comes out is that the observer influences the observed. What happens is, when you think deeply about any particular thing, you identify with that supreme force, and that supreme force identification is the ultimate cure for all your problems. Again, same thing. Birth is not in your hands. Death is not in your hands. But the journey in between is what we can make comfortable as possible. Cure is a euphemism. You walk into a hospital with chest pain, get something done, you walk out of the hospital without chest pain. You think you are cured. You walk into a hospital, or somebody walks into a hospital, has a hole in the heart, we close the hole in the heart, he comes out, you think it is cured. If that is the definition of cure, yes, we as doctors definitely will be participating or providing cure. But that does not. What happens is we are pushing whatever has to return to a little distance. The chest pain in many of these patients will return. But the time duration in which it will return is not in our hands. You can postpone it for a particular period. What I meant to say is that if you want a permanent cure, it is your belief, it is your faith. You can make it happen. That belief, that faith, that thing, you want to give it a name, Ram, Rahim, whatever you want, God, fine. But that we cannot replace as doctors. That's what I meant by saying that God is the only person who can cure you of all diseases. What we provide is help you achieve that state of cure. I hope that's fine. Right. Coming to the second point is investment and returns. It is a sorry state of affairs. Things are not that it is being driven by money alone, but it's sad but true that majority of the world today is driven or greased by money. I'm not blaming all those institutions for the mess that we have today. It's something which has come out because of diversification and because of our greed. If a person is not satisfied with what he has or aims for more satisfaction in terms of money, power, and these kind of things, you are not going to solve this mess. Yes, there are select few whose main interest is to see that benefits of science reaches the masses, which means that they will subsidize. But you cannot take away from the fact that all these developments are spurred by money or by some kind of investment. So as a temporary shortcoming, I don't think hating all these things is going to be the solution. Probably we will have to find a way, and I think Justice Chowdhury is looking at it, hearing the good deeds which are being done by the trust, calling in people from outside to speak to you, getting people to closer to in education, getting people to participate in providing for the society. I think that is the way to go. That is what I meant by public-private partnerships. And if I've left any other point unanswered? Okay. Anything else that I can throw light upon? Oh, I'm beginning to enjoy this session. I haven't seen so many questions. Yes, please.
Doctor, I'm a heart patient and I had a heart attack last year in 2022, the 23rd February. Then I was admitted. Dr. Basho helped me in getting admission in Guwahati Medical College. And I'm very fortunate that Dr. Basho at 10:30 at night, he took my call and he arranged all the doctors and I was admitted in Guwahati Medical College. And Dr. Barnali Datta, she is the head of the cardiology department, and she was the main doctor with other doctors. She told me the next morning that you had a heart attack. And I was in the hospital for 5 days. She gave me medicines and all. Then she told me that you have to undergo angiography to find out how much damage has been done. So I was taken to Gurgaon, and Dr. Shahi is there in Gurgaon Narayana Hospital. So I was treated by him, and all sorts of tests were done, and that TMT test was also done. And he suggested that you better take medicines now, and you come after 3 months. So I took some medicines, and after 3 months, I again went there. And after that, there was angiography. Angiography was done, and they found that 99% of my main artery is blocked. And they said, we can't put any stent. There's no possibility of putting any stent. And the only way out is bypass surgery. So my daughter contacted Dr. Ramakant Panda in Mumbai, in Asian Heart Institute, and 23rd May was fixed for my surgery. So before that, my daughter, she is an advocate in Kolkata High Court. She contacted Dr. Devi Shetty in Narayana Hospital, Bangalore. And at that time, I was in Bikaner. So he wanted to speak to the patient. He made a video call to me, and he asked me, what is your problem? I said, I have some uneasiness when I walk for half a kilometer. I become breathless. Then he said, okay, you come down to Bangalore, and I have studied your records, and we will do the bypass surgery. So I was admitted in Bangalore on 1st of June, and the tests were conducted on 2nd and 3rd June. And the PET scanning was done on 3rd of June. And 4th, I was to be operated upon. On 4th of June, in the morning, Dr. Shetty called me and told me that Dr. Praveen and Dr. Shetty, they had a meeting, and they have decided that surgery is to be avoided for the time being. It can be postponed because my heart was contracting quite efficiently. So the surgery was avoided, and they asked me to come for a review after 6 months. So I was discharged on 4th of June. And after that, I went again in December, and the heart was functioning quite well. And I was doing yoga, pranayam, etc. So my question, doctor, is even after having 99% of blockage in the main artery and blockage in the other two arteries, left and right, 70–80%, I could survive, and I'm doing quite well with the help of yoga and pranayam, and by the grace of God also. The surgery was postponed, not only postponed, but it was cancelled, you may say. So I'm thankful to God, And thankful to Dr. Sethi also for giving me the same advice of not going for the surgery. So your comments on this.
Gentlemen, give your name.
My name is Gaurav Bothra. I am a retired IS officer and I am presently working for the Police Accountability Commission.
You are from Tezpur.
I am from Tezpur. Yes.
Good, Gaurav. I think, was the retirement, voluntary retirement before the age of 60 or?
No, I am 64 running.
He's working, still working.
I appreciate how you stood up and told, because my visual impression was that you were probably about 45, 50 years old.
He's still working.
And you
So I
are
remember.
64. He's
Working-
64.
working, I remember.
And you're still working. It's extremely good. And I really appreciate the fact that you brought out native forms of therapy: pranayam, yoga, diet modification, and exercise. These are the basic things of life. And actually, you reinforced what the other gentleman was asking. It is not the team of doctors who provided you so-called cure. Again, the cure, we don't know. None of us can predict. But that particular thing, what you got cured, was your effort, your input, guided by the team of doctors. And you, I must say, have had excellent team of doctors, starting from Guwahati itself, medical college. You went all the way up to Narayana, which is apex, one of the apex institutions today. And the result is very clear. So what you reinforced was that man proposes, God cures. That's all I can say. And I think what you should be doing is spreading the same message, getting people to adopt a healthy lifestyle. Go back to the practices of pranayam and yoga. It will ensure a good quality of life. You may not need surgery. And I pray that you do not need any other form of treatment. Yeah, that's good. I think.
Thank you so much, doctor.
I saw two, yeah.
I have an implant of pacemaker in my heart. First one was done in 2000, year 2000, just after my retirement from service. Actually, this is the fourth implant I have done recently, 1 year back. What happened, all the three implants were done very smoothly. I could walk, after 2 days doctor allowed me to walk. I had to walk in the hospital veranda and all that. For 7, I stayed in the hospital maximum 1 week. After that came back and did my, whatever I am doing. This fourth implant, it was also done nicely. Not by the same doctor, but one young and qualified, highly qualified doctor. But what happened, it was implanted and I was, next day or day after, he discharged me from hospital. 2 days after the operation, he discharged me being, thinking I was fit and good enough. But after 7 days, what happened? One day after my food, I simply collapsed. Right away I collapsed, and next 3 days, I was in the ICU obviously, but I was hovering between life and death. Next 3 days. So what happened, it was examined by different doctors. They said while while fixing the implant, the artery, the while lead was being fixed, it punctured the heart. So heart started bleeding. So I collapsed. So after 3 days, I was more or less okay. What I feel, what mistake that doctor did, putting the lead inside the heart, is it very tricky job or simple job? He just, hurriedly he did it, and I was hovering between life and death. Give me a simple answer. If I should go, if necessary, I should go for another transplant, or it is enough now. I should forget, because I am 84 plus now, 84 plus.
Okay.
Okay.
So basically what you are trying to tell me is that you had one pacemaker implant followed by 3 times change of pacemaker and the lead. And during the last one, you had a little bit of difficulty. I would not blame either the technology or the doctor or any one of the things concerned. Basically, one must understand that technology, however advanced, at a particular point of time, is always going to be replaced with better technology. That better technology gets replaced by something even better. During this replacement, there are 2 or 3 things which are of concern. One is, what is the box which is present over there? The other one is what connects the box to the heart inside. That is called the lead. This is called the pulse generator. The pulse generator contains the battery which powers the entire system. And battery does not last forever. It has to be replaced at some point of time. Generally, a battery lasts for 10 years, and in your case, it has been replaced. But what happens is the body tends to reject any material which is coming into the system. So the lead or the connecting cord between this box outside and what is being pushed is electrical energy to the heart to make it pump. This thing can get displaced. If you put that lead in very deep, it can come out of the heart. If you put that lead in very lightly, due to the contraction of the heart itself, the lead can get displaced. And if the lead gets displaced, it does not function. So you understand that it is a very tricky situation. Technically, it may not be that demanding, but that decision of how much to go in is very, very tricky. That is why I said artificial intelligence cannot replace this art of walking that small gap. And please understand, the thickness of the muscle is probably 1 centimeter. In that 1 centimeter, if you go in too deep, maybe about 3 millimeters deeper than what it should go, you are outside the heart. If it is 3 millimeters less than what it should go, it gets displaced. When I say 3 millimeters, it is not exact 3 millimeters. Even though we know that difference between 3 millimeters, and 1 centimeter is very, very tiny. So that is the gut feeling of the doctor. And yes, your doctor did the right thing. Did you have to undergo an open heart surgery to fix that bleeding? No. Again brings us to his answer. We can prolong life, we can give you a better quality of life, we can probably influence a little bit with the other things, but it is God only who cures you. I can't hear you, sorry. Mike.
My daughters advised me and other relatives also, who are doctors, that we go for a legal thing. It was it, I said no, I love doctors, my mother was a doctor, so I love them, so I did not endorse any legal thing.
Sorry, I'm not able to hear the full question. Yeah, if anybody can.
Take some extra care.
I take care for the heart, but for walking, even swimming sometime at this age of 84 plus. Can I continue all these things, or I should be take extra care and remain in the house mostly like that, as my wife would advise?
Very interesting point. Now, what is it that you are looking for?
I look for that I should keep on working like that and all that.
So you have answered your question. Why be bothered about anything else?
No, others,
You are looking for quality of life. You do not want to sit at home and keep, live to 150 years.
No.
What you want is, be it 90 years, be it 100 years, be it 125 years, I want to walk, I want to get up and go and do my life.
That is what I need.
That is what you should be doing. Just forget about anything else. All of it will not be of any use. 150 years of sitting at home is not worth the 10 years of good active life.
That is what is needed.
Yes, I think that's what you should be aiming for.
Okay. Thank you. Thank you.
All good things must come to an end. We will conclude because I am grateful that you always come and attend it and giving us impetus. We started this heart matter first of cardiology by Dr. Upendra Paul. Today we come to the surgery part through our doctor. I asked Amitabh when he was taking surgery. I asked him, why don't you go for neurosurgery? And he told me that, look, end result is not good. You can't, mostly people come brain dead, so you cannot help anything. And that has exactly worked with him. So this is the faith or whatever you say. But about these things, we are speaking about how to keep a good heart or it all depends on us. You live a good living, live a little exercise. No, you do not run away. Even if you are at home, you walk few paces, it will do. But it depends. You have to live peacefully. That's the main thing. Thank you very much. You have all come here and you are really, I was thinking that what is the use of it? But today I have realized that the lecture series has given us some useful thinking. Not only we throng together, all the people from this city mostly come together, we meet, some newcomers are coming, some old faces are wavering. So anything, I am grateful to you. You have given us the impetus. I am grateful to Dr. Jagannath from us. And with that, we conclude. We are very grateful to you. Thank you very much.
May I request
We will have some light breakfast.
the audiences present to join us for some light refreshment?
Outside. Please come. I have usurped the presidential power. Keeping the president said I close the meeting with his permission.
No, that's all right. Everything is done very proper manner, and the settler himself has given the entire picture before you. And we offer vote of thanks to all of you who have come here, including the judges of the High Court, both sitting and present and past, advocates, senior advocates, teachers, Principal Dr. Vaishya, and other dignitaries and other persons and audiences, including advocates and persons from various divergent fields. Your presence is our encouragement, and we hope that this encouragement you will shower on us all the time to come. So I offer my vote of thanks to all of you, including I offer my vote of thanks the media, both print and electronic, as well as the ground staff, the floral decorator, and other persons involved in attending this, in coming to a complete conclusion of this ceremony. And I further offer my vote of thanks to the authority of this institution who has been kind enough to provide us accommodation for holding this meeting. So thank you all. Kindly we have arranged for a small light refreshments. Kindly arrange that, attend that.
Grateful, ladies and gentlemen. The meeting draws to a close.